today's video, we're going to talk about GERD, reflux, and digestion issues generally. You may not think that somatics can help with these things, but all systems in your body work better when your muscles are relaxed. So I'm going to show you a fairly short sequence that should help with digestive issues such as GERD, reflux, indigestion, those kinds of things. Give this a try, see if it helps. Any benefits you feel are going to be secondary in nature as a result of relaxing the muscles. But give it a try, see if it helps, and you can let me know how it goes. So to begin, bring the legs to bent. And we're going to put the hands behind the head like so. And then just take your time. You're going to bring the elbows in. We're going to curl up to look at our knees and press our back down. This is going to engage our belly. You can take your hand and you can feel your belly muscles here with your hand. You'll feel they're quite strongly contracted in this position. From here, as slowly and smoothly as you can, you're going to come down nice and slow. And then let your elbows tip out again. So we're just starting to relax the belly muscles, the abdominal muscles. And when you're ready, we're going to repeat that. Elbows in, curling up, pressing the back down. Make sure you can feel your belly muscles contract. And you can actually keep your hand here as you come down. Nice and slow. Feeling the belly muscles lengthen out. And slowly release. Okay, we're going to repeat that and we're going to add a breathing differentiation. So this time when you curl up, you're going to hold the top position. So let's do that. Elbows in, curl up, pause here in the top position. And from here, I want you to breathe as deeply as you can on the inhale. And then exhale. And we're going to repeat that again, inhaling. And exhale. And then one last time, inhaling. And then coming down on that exhale. That just allows us to differentiate the inhale and exhale from the muscles of the belly being contracted. Okay, and we're going to do one more release of the belly muscles in this position. So elbows in, curl on up. Nice squeeze of your belly muscles. Make sure you can feel them contracting. And then slowly coming on down like so to rest. Okay, so just let your legs be straight, see how that feels. If you've done that slowly and carefully, it should feel quite soft and open through the belly and should feel a bit more easy to breathe as well. Okay, so we've relaxed the abdominal muscles. This is going to give some ease the pressure inside in the abdomen where your stomach is and your guts, etc. So from here, bring your legs to bent again, but this time put them kind of wide apart like so. And with your arms to the side like this, bring your attention to your left leg, and you're just going to let your left knee tip in, rolling your pelvis to the right like so. And then slowly bring your foot back to standing. Then you're going to do the same thing on the right, letting your right knee drop in, rolling your pelvis to the left. And just go back and forth like this a couple of times. And as you're doing it, notice that to turn the pelvis over is to move the entire trunk, okay? So this rolling back and forth of the pelvis and the knee dropping in alternately is very helpful for moving your internal organs, sort of giving them a nice little massage as you go back and forth. And if your belly is tight, it can be difficult to do this type of thing. And that's why we released the belly first. So now we can go back and forth, alternately rolling the hips to one side or the other and letting the knee drop in. So as the right knee drops in, the pelvis rolls to the left. As the left knee drops in, the pelvis rolls to the right. And this movement is very pleasant to practice. Okay, and just breathe comfortably as you go back and forth. See if you can make it feel nice and smooth in both directions. And notice as you turn your hips over, you're lengthening out your belly in both directions. Okay, let's just do one more. And come to rest. All right. Okay, so now that you've released your belly and you've rotated the trunk and hips a little bit, just notice how that feels. should start to feel quite a bit more comfortable through this whole area here. So in the back and the front and in the pelvis. So you've reduced the tension in the belly and you've moved the internal organs by virtue of moving your torso, twisting your torso back and forth. Okay, let's do one more movement to elaborate on this a little further. Legs to bent, arms out to the side. And this time you're going to let both your hips and knees tip to the right, we'll start with, head will go left. And notice that this is the same movement of the pelvis rolls to the right, and then slowly come back through center, tip your knees to the other side, head goes to the right. And now we're just involving a little bit more of the body in the twists because we're turning our head and we're turning both our legs. Go back and forth like this. Again, notice how it lengthens the belly out, so it's decreasing tension in the belly muscles, which is going to decrease pressure inside in the abdomen, which is going to help with all your digestive issues and your breathing as well. Go back and forth like this. A couple of times. And as you go back and forth, just as your knees tip over, just lift the rib cage up a little bit and you'll get a nice sense of tension in the upper and middle back, and then drop down to the true center. Turn to the other side, and again you can just lift your ribs up a little bit. It gives a nice pleasant sort of yawning feeling to this movement. And again, lifting the ribs up further opens up the belly muscles to further increase comfort. Okay, and you can go back and forth like that for as long or as short a time as you like. Okay, and back to center. From there, lay flat. And again, just check in with that and see how it feels. You should be feeling quite a bit more comfortable all the way through the center of your body. The belly muscles should be nice and soft. Now, just to close this off, let's bring the legs to bent again. Hands behind the head. And let's just do a couple more of the movement we did at the beginning to make sure our belly muscles are nice and relaxed. So, elbows in, curling up, making sure we can get a distinct and clear contraction of the belly muscles. And then as slowly and smoothly as you can, relaxing back to the floor. One last time. We're going to come up on an exhale. Making sure we're getting a deliberate contraction. That's the most important bit. Deliberate, clear contraction that we can feel, so that when we come down, we can feel that contraction easing out, relaxing out, all the way back to rest. All right, let your legs be straight. Take a moment to notice how that feels, and just enjoy that feeling of relaxation and softness through your trunk. So that's a simple sequence to help reduce tension in the belly muscles, which should give you some improvement in any digestive symptoms that you may be experiencing. Of course, there may be other things you need to address as well, but if muscle tension is contributing to your digestive issues, your GERD, your reflux, this is going to help in that regard. Give that a try and let me know how you get on. If you'd like to take a full class with me, there's a link in the description to my on-demand video library where you can take full classes. Thanks for watching, and I'll see you next time.